Hello everyone, this is Dr. Aditya Gupta. So this is not a strategy video on how to prepare for next or something on those lines. This is just a genuine heartfelt video about what I like, what are my feelings about this, just connecting to everyone who's there. Only one thing, I really want to tell to NMC that you really fucked this up, to be very honest. You really you wanted to make it something that's, you wanted to, their words actually were that you wanted to alleviate anxiety and so on and so forth. You just increase the anxiety of a lot of students. You just increase the nervousness of a lot of students about this exam. You just cleared one thing. You had the opportunity to clear a lot of things, but you just cleared one thing. The only thing that you cleared is that 2019 batch is going to give NExT. Definitely, that is true. But you really did not clear when will that happen. You said it will. You said it in November and May, but which? Is it going to be this November 2020 or is it going to be May 2020? Not 23. Is it going to be May 2024? Absolutely zero clarity about the current batch of interns and post-interns. How will they appear? Will they appear for this NExT to appear for to get entrance into a postgraduate entrance examination, or will there be another NEET PG in the interim time? Everyone is speculating at this point of time that there will be a NEET PG 2024. You did not give anything about that. You did not give any clarity about that. It's only speculation at this current point of time. So instead of decreasing the confusion, instead of decreasing the anxiety, you actually increase the anxiety and increase the confusion with absolutely no clarity about these two very important points. What will happen to the current batch of interns and post-intern? Will they give the NEET PG or will they give NExT? And you never clarified even for the 2019 batch whether they have to give the NExT in this November 2023 or whether they have to give it in May 2024. That thing is absolutely not clear. Some logical inferences that I can draw is that yes, I'll say that INI-CT November, this INI-CT November is definitely going to happen, and to a certain extent even May 2024 will also happen. The reason I'm reasonably sure is because unlike NEET PG colleges, AIMS and Institute of National Importance, your AIMS, your JIPMER or your PGI, they take residents every 6 monthly. So in 6 months, some batch of residents is going to pass out. The resident strength is going to decrease. So AIMS definitely will conduct the November INI in order to, it's not just an entrance examination. It's a sort of a residency employment scheme also, if you want to call it that way. So AIMS definitely is going to conduct another exam in November and most likely in May 2024 because they require residents. So they cannot wait for NMC to, conduct a NExT and then through that NExT, they will take on the basis of that, they will take the residents. So I don't think so that's going to happen. Plus, AIMS has all the authority to do that because AIMS has a separate act by which it was formed, which is radically different from the NMC Act. AIMS has its own authority to conduct its examination and which can supersede the NMC. So it can conduct its own examination on its own volition. So most likely the November 2023 AIMS INI-CT definitely can happen. Same for May 2024. After that, again, nobody knows. You did not clear it. Small strategy, how to prepare. Since now we are 100% sure that only 10% is going to be first and second prof, it doesn't make any sense that you read anything beyond first aid. First aid is like your go-to resource. First aid, these 600 pages are so super concise and so high yield that they used to suffice for NEET PG also, where the importance of the subjects used to be much more. In fact, first and second prof used to account for 50% of your syllabus. If not 50, at least 40%. So now, when it's going to be just 10%, it doesn't make any sense that you read too much. Restrict yourself to these 600 pages and you will be sorted. Just these 600 pages. Second thing, that in order for how to prepare, again, I'm not someone who has actually given this entrance examination. So my advice is take it with a pinch of salt. I'm not someone who has given this examination. I've given NEET PG, I've given NEET UG, I've given, AIMS. That's why I was so confident in my advices that those advices are definitely going to work. Because I gave those exams. I know the mistakes that I made. I know the mistakes what people make. This is a totally new ball game. So my advice, always take it with a pinch of salt. These are just my inferences on how me imagining yourself in your position on how probably I would have prepared. Right? Definitely it can work. Definitely there's a possibility it might not work. But these two things I'm definitely sure that even if I was right now, I would have definitely gone only for first aid because there's no point 10%, just go for the 600 pages. At least your first and second prof, those 10% is sorted in the form of the least material but most high yield material, right? Second thing, AIMS is going to conduct the exam. This has been made clear by NMC. So obviously AIMS has a tendency to ask its own previous year question and previous year topics. So a lot of people who used to prepare for NEET PG never used to do AIMS questions. Now, I would say that definitely since AIMS is going to conduct NExT, please solve past 5 to 10 years INI-CT previous year question. Now, there is a caveat to that. They specifically mentioned, the NMC chairman specifically mentioned that they want to cut down on marked topics. Now, this marked topics obviously can mean that they want to cut down on previous year question. Having said that, AIMS, I find it unlikely that AIMS will cut down on its pet topics, because they do are in general, AIMS in general has been a very clinical sort of an exam. So even if the percentage might come low, your best bet about knowing what the pattern of the exam is going through previous year questions of INI-CET, because they used to INI-CET and AIMS always from the very beginning used to be very clinical in nature as compared to NEET PG. So going through those set of questions will at least, even if they're not exactly repeated in the exam, it will at least give you an idea about what topics are important for the exam and how AIMS can frame its question. Because AIMS is going to conduct the exam, so obviously the framing of the question will be similar to the framing of the questions of INI-CET. So these are the two strategy related inferences I can tell. For first and second prof, there is absolutely no need beyond first aid. And for preparing from questions point of view, you have multiple Q banks. Marrow is a good Q bank, Prepladder is a good Q bank, whichever you want to use, that's perfectly fine. Pre-PG is also a different one. Reflex also is there obviously, but definitely do INI-CET past 5 to 10 year questions, because since AIMS is going to conduct, it doesn't make any sense that you don't do INI-CET previous year question. Okay, don't restrict yourself to NEET PG question that a lot of people used to do. It's good, it would be great if you do at least past 5 to 10 years of INI-CET previous year question. My only request to NMC would be at this point of time that people are really anxious, confused, nervous. This was a great opportunity for you to quell all the doubts, and you thoroughly wasted it. I would request every intern and post intern that there is a query email available on the NMC website. Please flood it with what will happen to you, whether you have to give next or whether there will be a NEET PG. Maybe that will serve as a wake up call for them. Please give clarity. This is a request from my side to NMC that please give clarity. For past 3 years, we all knew about this pattern of exam that you just talked about. We did not know about what will happen to interns, post interns. You still haven't cleared that. We did not know when will it happen. You have just cleared that it will happen in 2019 batch. You still haven't cleared whether it will happen in November or whether it will happen next year in May. So please give clarity regarding that. From a personal point of view, since I'm a part of AIMS, and last year I was at least a part of RDA, and I have friends in RDA, I will try that at least RDA, not protest, obviously probably won't be possible. Let's see if that happens. But definitely maybe a letter directed towards NMC, a direct contact, to try to contact NMC chairman, because he's a past ENT HOD from AIMS itself, so that NMC actually gives more clarity. That's something I can personally try from my side, and I definitely will, because I believe that the student community definitely deserves